already seen me, but I want to quickly introduce myself for those of you that might be new to this meeting. My name is Marianne, and I'm with UNESCO ICPA. ICPA is the International Institute for Capacity Building in Africa. And we are working under the KIX Africa 19 project. KIX stands for KIX, Knowledge Innovation Exchange. And we are a project funded by GPE, the Global Partnership for Education, and managed by the IDRC, the International Development and Research Center of Canada. And we are a consortium of 3 partners comprising UNESCO ICPA, UNICEF ASARO, and the African Union. So I want to welcome everyone for being here today, and just recognize the wonderful diversity in the room. We have 19 countries part of our project, all across Sub-Saharan Africa. It would be really nice if you could name yourself with your country. So if you go to your Zoom box, your little box in Zoom, and if you click on the upper right-hand corner, the 3 dots, you can see the 3 dots there. You can click on that and then add rename, go down to rename, and add your own country after your name. So if your name is, like in my case, Marianne, keep that, and then add your country right after your name. It'll help us appreciate the diversity in the room. We have a lot of countries in different regions present. So please add your country name, and it'll also help us to put you into breakout rooms for an activity soon. So Gabriel, can we go to the next slide, please? I think there are some maybe instructions on this. Okay, so just a moment for this. I'll put the instructions in the chat box in a moment, but please add your country name after your own name in Zoom. Someone's having trouble with her microphone, Martha. Martha, I'm sorry to hear that. Maybe you could try logging out and logging back in again. Okay, so just one more second for this. If you could please add your country name after your actual name in Zoom, it'll be great to see the diversity in this room today, as we're coming from all different regions and countries, mostly in Africa, but also even around the world. And it'll also help us to put you into a breakaway room for an activity soon. Okay, so if you click on go to your box, your little box with your picture and your name in it, up to the upper right-hand corner, there are 3 dots. Click on the 3 dots, and then go down to the options it gives. It gives to mute yourself, etc. Go down to rename on the very bottom. Click on rename, and then add your country name after your actual name in Zoom. Okay, if you have problems with this, let us know in the chat box. We're going to move on now. Again, greetings to this course. You know that by now we're using the same Zoom link every week. And when we're in this course, we'd like if you could mute yourself when you're not speaking. It just helps us to keep everything on track. And when you do speak, we love to hear from you. We love to see what ideas that you have. Keep your questions and your responses as concise as possible and as direct as possible, so it allows as many people as possible to get involved. And we are all here to learn, listen, and grow. It doesn't matter where we're from, how much we know about these topics. We're all here to learn something from each other. Next slide, please, Gabriel. So some of you may already know this, but if you don't, this is a quick overview of the 3 parts of this course. So right now we're part of Module 1. Module 1 is a series of 6 workshops on topics that you identified previously back in August and September when you took a survey that we took. And these topics will be over the course of 6 workshops from starting from 2 weeks ago, or sorry, it was actually last week, I think, up until the 7th of December. So there are 6 workshops total. And then after these 6 workshops, we're going to give you the chance to work on a practical action plan for yourself. That is also the culmination of the class. You create a professional action plan that details your commitments to prioritize gender equity in your otherwise normal work agendas. So in December and in January, as you're making your work plan for the next year in your ministries or in your projects, in your programs, in your departments, think about how would you incorporate gender equity more? How would you prioritize gender and equity and inclusion more in your work? And think about that, and then detail what kind of support you're going to need. What kind of resources do you need in order to prioritize gender more in your work? Do you need some research to help you learn about a topic more? Do you need some connections, some partnerships, some alliances to help you connect to others who are also doing this kind of work? Do you need to consult somebody in your own department? Do you need to convince somebody of the importance of gender equity who's maybe thinks that it's not a priority? So we'll talk about this action plan a lot more in sessions 5 and 6, because then you'll be embarking on doing the plan. But we want to introduce it each time so that you're aware that there's a little bit of a homework task. That is, if you would like to have the certificate of course completion, and you'll have a month to work on this. And then when you come back after the winter short break that we'll have, sometime in January, maybe going into February, you'll get a chance to present your professional action plan and maybe how it's been going for you as you have begun the year now, 2024. Okay, so next slide, Gabriel. The last thing I want to quickly share are the links for this course. So we have 3 links we'd like to share with you. First of all is the WhatsApp group link. That is a specific group for this class. The link will take you to joining this group. So click on that link if you haven't joined it yet. We invite you to join it. It's not a group for spamming or for lots of unrelated messages. It's a very targeted group just for people who want to talk about gender issues and maybe share resources and evidence from their countries. So it's closely monitored, and we encourage you to join that group. The next link is a resource pack. In this resource pack, we're adding the PowerPoints from each session, the recordings from each session, and also some knowledge resources like a glossary of terms for understanding the different terms that we use, like equity and equality and responsiveness and transformativeness. So that's a link that will be continuously updated over the course of our 6 sessions. And then we have a parking lot for ongoing questions that you have, some ideas, realizations. So if you don't want to post a question to the WhatsApp group or otherwise, you can post it into this chat box or in that parking lot, and we'll take a look and we'll attempt to answer your question. So I'll just stop there, and I want to turn it over. Gabriel, next slide, please. I'd like to introduce our facilitator, Mercy Mupafayenda. She is, as you know, from the University of Witwatersrand from South Africa, and she's taking us through concepts today in programs in gender equity. So over to you, Mercy. Thank you.
Hello, everyone. Can you hear me?
Yes.
Yes, okay.
Yes.
Yes. Welcome back to everyone who's been tuning in since the 21st of November. Thank you for coming back again. May I please have the next slide? So we are going to start off with a recap for session 2. And just to say that if there are people who are new, who were not here from last week, we do have a resource folder on our online where you can go and find all the materials we've been using and the sessions we've been doing up to now. But if you have a burning question, please don't hesitate to put your hand up. So last week, our session was on diagnosing gender inequities and barriers in education systems in Sub-Saharan Africa. And our learning outcomes, we wanted to make sure that as participants, we gain knowledge, skills, perspectives necessary to identify and diagnose gender inequities and barriers in the various education systems that we find ourselves in. Thank you. Next slide. Yes. So the questions for session 2, like the questions that were guiding us through the topic were, how can we apply an intersectional approach to diagnosing gender inequities and barriers in the region? And also, what gender responsive and gender transformative approaches are relevant to the identified inequalities, inequities, and barriers in the different contexts that we are in different countries as the 19 countries. Thank you. Yes. So last week, our key concepts that we were using to learn from were structural inequality, or what you would call system barriers. We also looked at intersectional challenges, and we also looked at gender responsive and gender transformative approaches. So for now, I would like to give maybe two participants to just share with us what they gathered from these concepts last week. We can move the slide, thank you. Would you like to share, at least two people, if you can share quickly what you remember about systemic barriers and intersecting challenges, and also the gender responsive and gender transformative approaches. If you learn something else, that's not what I'm asking at the moment, you are also free to share if you have something that you feel like you really learned last week. Am I missing any hands? I haven't seen anyone. Would anyone like to share with us what they learned last week?
Hello?
Yes. Yes, is that
Phumzile from Eswatini. I don't know if I'm very clear because I'm traveling. So
okay.
Yes, but under structural or systematic barriers, what I learned was the school system, the education system as well can have these elements of barriers with the books that the children are learning, the pictures, they can depict that a woman's place is in the kitchen, and probably the language that is used by the teachers in terms of you are actually, the example you made was this subject is for the is not for the weak-hearted. So I think that is what I picked, that some of the barriers are systematic in nature. The system, the school system itself, what kind of duties can be done by girls, or what kind of subjects are suitable for girls, not for boys, things like that. I think I'll pause.
Thank you so much, Phumzile. That is so correct. We did say that, yes. And I see that in your answer, you even managed to touch on session 1, where we dealt with stereotypes that may be in the curriculums, and also just in the way the structures are built, also in teaching pedagogy, also depending on whether the teachers themselves, the languages that they use. Is there anyone else that's got their hand up? Is it Machidiso? You can go ahead.
Matsidiso Adoro.
Okay.
Yes, what I learned from the last week's session, I learned that the systemic barriers are those things that hinder children to learn properly. distance can be one of them. For example, in my country, Lesotho, schools are very far from the villages. There are rivers in between. So now the children sometimes get raped when they are going to schools. So in the bad climatic conditions, they do not go to school. This also can hinder a proper learning. Thank you.
Thank you so much. Thank you so much for that contribution. It is true that we spoke about safety issues. I think even on the first session, we spoke about safety issues. And on the second session, we did again. And the issue of transport and having to go far also speaks of the different system levels where you find problems that hinder us learners. Not just home, because sometimes we tend to focus on the home and the cultural barriers that are within certain places. But when we are now talking about having to cross a river to go to school, it becomes a national government problem and a national system which needs to be addressed at that high level. Thank you, Petros.
Hello, thanks so much.
Yes.
Among the things that were my takeaways, in many countries, there's gender-sensitive plans, strategies. The problem is understanding the true essence of its contribution, and the problem with the commitment of the leaders down to the school level, from the university to the school level, is a problem. Totally, the implementation is a problem. But people are starting to consider gender issues and they are becoming sensitive. So we need to work on the implementation. This is one that I learned from the last work.
All right. Thank you so much. Thank you so much. Yes. So we are.
Hello. Yeah, this is Keba from the Gambia.
Yes.
Yeah, just looking at the barriers. I think my takeaway there is poverty plays a great role in terms of barriers, which is actually we may want to call it maybe it's either systematic or structural. But I know poverty is a great contributor to barriers because cost of schooling, and the location of schools, like somebody rightly said, of course, also early marriage, because of poverty, also leads some communities to give out their children's hand in marriage. And of course, this creates a great challenge, or poses a great challenge, and so being the case brings about so many inequalities in the education system. So I think this is something that I just want to add on to. Over.
All right. Thank you so much. I won't be taking any more, but think any more hands at the moment so that we can work a bit faster and get to our case studies for the day. But thank you so much to everyone who has contributed, and everyone else who still had burning questions. You might have a chance to also speak when we are now doing our case studies. Thank you. Next slide. Next slide, please. Okay. I think since we have discussed the systemic barriers and all of that, can we skip all the slides now for recap and go to the new slides for today? Thank you. Yes, yeah, there. Thank you so much. Yeah, it's very encouraging to see that even as we are talking and exchanging and answering questions, it's very encouraging to see that we are retaining most of the concepts we have learned. We are also retaining so much information and knowledge that others are sharing. So for today, our session 3 is evidence-based programs from Sub-Saharan Africa. for increasing enrollment and keeping girls in school, which is also referred to as retention, and reintegrating girls who drop out. Our learning outcomes are that participants will share and gain knowledge of approaches used in various countries to increase girls' schools enrollment, retention, and reintegration. So we can move on to the next slide. So today, okay, the idea is to focus on evidence-based projects which have actually been implemented in different countries, as opposed to maybe just speaking about what we think might work. So for today, our concepts are evidence-based programs, and then we have enrollment, we have retention, which is also avoiding dropouts, and we have reintegration. Yes, we can go ahead. Yes. So our driving questions for today are: how can policy actors identify factors leading to low enrollments, maybe even high dropouts in specific contexts? So where you are and where you are based in different countries, how can you as policy actors identify factors leading to low enrollments? Because this is how then you'll be able to go and find, if you understand how to find that information and that knowledge, and to know the factors that causes low enrollments, it will be easier also to look for case studies that are relevant in your own context. So our second question is: what are some of the evidence-based ways of increasing enrollment and retention in specific contexts? And our last driving question is: how can policy actors approach identifying girls who drop out of school and reintegrating them into school? Thank you. Yes. So before we carry on, I wanted to ask if we can all see the screen. I'll read out. We have a statement there which was made by a foundation, one of the foundations that's partnering in trying to reduce dropouts, and also maybe putting together data which helps policymakers to make decisions that are based on knowledge or evidence-based programs. So they say here, the explosion of teenage pregnancies caused by school closures during the COVID-19 pandemic is likely to compound the gender gap in education for a whole generation and illustrates the critical role of secondary education in reducing gender inequality. So my question here, which I would like maybe one person to answer, is based on session 1, learning. What comes to mind when you read the above statement about teenage pregnancies? What is the first thing that comes to mind?
Hello?
Yes. Who is it?
Keba.
It's?
Keba. This is Keba from the Gambia.
Okay, thank you. Please go ahead.
Actually, what comes to mind is that education, let's say schooling, is a factor that reduces teenage pregnancy, because when they are in school, they do not have the time to go out and then, be around, because they don't have the time to loiter around. So schooling is a factor to reduce teenage pregnancy. That's what comes to mind.
Okay, all right. Thank you so much. Yes, research actually supports that. I think all the literature we've been looking at supports that when girls and even boys are spending more time in school, it also means that they reduce the negative opportunities that are out there. But I was also interested in the way this statement is written, because we were talking earlier about stereotypes or inequality. So I also wanted to draw your attention to the language that we use when we are either policy actors, or we are teachers, or we are researchers. For example, if someone writes, the explosion of teenage pregnancies caused by school closures, right? How can school closure cause pregnancy? So in my view, this kind of writing actually does not address the perpetrators, does not address especially the men, right, who are getting children, even children pregnant. Here in South Africa during COVID, we had about 33,000 girls that were below 18 pregnant because they were at home. But I wanted to draw your attention to language, to pay very critical attention to the way things are written, because it creates a silence about what the issue is. And it's ridiculous to say that teenage pregnancies are caused by school closures, as opposed to saying when children are at home or when they're elsewhere, this is what happens. Thank you. We can move to the next slide. So we are going to start off with a little background of the challenges and the successes of enrollments and reintegration, so that at least when we get to our Zoom slides, you will have a background of understanding some of these problems that are leading us to the figures that we are seeing. For example, in Sub-Saharan Africa, we are told that out of the 59 million out-of-school children of primary age, 32 million or more are here in Sub-Saharan Africa. And following widespread adoption of free primary education in low-income countries and the subsequent increase in primary school enrollments, policymakers are now shifting their attention to making sure that more children, more girls are getting into secondary education. And we are also told through research that secondary education remains a challenge, with enrollment rates of only 43.6% in the region. Thank you. Yes. So female education also remains a key challenge in this part of the region, which is also home to the largest population of out-of-school girls. I think we know that. And then the COVID-19 pandemic, it's also important to talk about what has happened and why we feel that we will not be able to meet our sustainable development goals. For example, COVID-19 aggravated more dropouts, and we are told that up to 5 million girls globally might never return to school. But then we are also told that providing subsidies for education is an important commitment to make in a post-pandemic context. So the case studies we're going to be doing are going to be showing you how in some countries and in some areas, these subsidies have actually been provided. But what's also important to note is that since more girls are out of school than boys, it is important to examine the gender implications of these different strategies. Remember, in session 2, we spoke about being gender responsive and gender transformative approaches. So the first thing we are already told is that, yes, we have a problem of enrollment, but it's also a gendered problem. Thank you. Next slide. So some of the findings that we have on hand are that girls are systematically lagging behind, and as a result, they don't actually complete schooling in terms of secondary or even go further most of the time. And they also have problems with their literacy and educational attainment levels. For instance, less than 15% of girls complete lower secondary education in the Central African Republic of Chad and in South Sudan. So when we are given data it helps because then we know what we are looking at. And also, if we are talking about 15%, I think what you can then do is look at your own country. For example, South Sudan, what is the population there? What is the data that then you can be able to see if 15% of girls are completing, what does that leave you with as a country? Thank you. Okay, so factors affecting enrollment. I noticed that when we were doing the recap, most of them were already named by our participants. The fact that poverty and economic barriers are some of the either poverty or economic barriers or whatever you call it, but those are the barriers that are quite entrenched. And poverty remains a key barrier to school enrollment, especially following economic disruptions triggered by COVID-19. And also, while tuition fees for secondary schools have been eliminated in sub-Saharan countries, households still face substantial direct and opportunity costs when sending their children to school. So you can see that this particular slide is actually making reference to the intersecting barriers that we were talking about before, because now, even when people are given, subsidies, there are other problems that they still have. And in rural areas, for example, households often do not have a secondary school in their village, and girls have to use costly transport to walk alone. And also it raises safety concerns. I'm happy that one of our participants had already raised, I think, 2 or 3 of those points. So another important and also very prevalent issue here in sub-Saharan Africa is that of early marriage and pregnancy. So we are also told that when girls drop out of school because of poverty, they are most likely to also get pregnant because they are away from school and they are not safe, or because they get into transactional relationships where they will be trying to meet their basic needs. So research also tells us that secondary education plays a significant role in reducing early marriage and pregnancy. Thank you. I think we can, should I skip this one? Okay, let me just take it, but shortly, because I'm wary of time and I want us to move to our, if we don't have the invited speaker here yet, we'll move to our Zoom breakup groups. So in conclusion of introducing today's topic, I just also want to point out that at the moment, we have governments and various stakeholders and partners that are testing a wide range of innovative approaches to address gender-specific barriers to school participation and learning from interventions. So some of the ones that we know that we've even looked at, right, is school gender-based violence. One of our case studies last week on in Zimbabwe was actually about gender-based violence in schools. And then some of the things that have also been done is to integrate supplemental female teachers to support gender-sensitive pedagogy, and also to reduce cost of schooling through cash transfers in order to then keep girls in school. So you will see that when you start working on or you get to look at your guidelines, these are some of the questions that are there, where with the case study that you'll be looking at, you'll be required to also identify the partners that are working together with governments. If you can do that, then it will also help you to understand your own context better and to even know who to approach after you leave this course. Thank you. Okay, so some of the evidence-based programs and why I shared, maybe I should just give a little background to why I shared the evidence-based programs that I did. We are told that up to now, only 2 experimental studies in Sub-Saharan Africa have actually estimated the causal impact of programs for alleviating costs of secondary education. So while the studies may appear long that I gave you, I trust that you'll be able to start working on them, even if you finish them when you are back home or in your own time. The reason why I shared these particular ones is that we are trying to identify evidence-based programs where we can actually say, okay, we gave someone this much, they were not going to school and now they are going, and then at the end, we receive whatever percentage of people have gone back to school or have started enrolling. Thank you. Okay. So as I've already been saying, unless someone has a question for me, I'm now going to give instructions, share instructions on what we are going to do in breakaway rooms. But so far, are we all together from what I was saying, or do you have any burning question you have before we go into the different Zoom breakout rooms? If you do have, please feel free to let me know. So these are our notes for participants. Okay, yes, Martha, thank you.
Mine is not a question. I just needed to make a comment
Yes.
to say that, especially on the case study that I was talking about COVID and effect of COVID on dropout as a result of pregnancy. Actually, in Malawi, we had a very big problem during that time. We had a lot of girls who left school due to pregnancies, as the case study is saying. From the same, what we realized is that with just a girl dropping out of school, we are actually affecting almost the entire generation, because the child she's going to give birth to might not be properly taken care of, and she might not pose a very good example to the child when bringing her up. So the lack of education that she has at the moment because of the pregnancy might affect the way she would groom this particular child towards education. So it's really a problem that affects a number of generations beside the generation that the mother is in. Thank you.
Yes, that's a very, very correct observation, and it's also in the literature about gender and education. Hello? So if no more comments, okay, I will carry on. So
hello,
we have.
Can I say something?
Sure. Who's speaking? Sorry, I can't see your name. Yes, you can go ahead. Hello?
Hello, Petros. Were you trying to say something? Petros?
Did we lose him?
Mercy,
yeah,
Petros is here. Maybe he can.
Yeah, hello.
Yes, Petros?
Yes,
go ahead.
Yeah, in relation to girls' education in Sub-Saharan Africa, the commitment of the government, the system, working with the system might help, but equally important is the societal activity. Towards girls' education, towards family leadership. So we need to focus again on working in the community, our communities, so that we can support the girls' education. Just to answer the question. Over to you, please. Thank you.
Okay, thank you. Thank you so much, Petros. Thank you for that comment. So I'm going to continue now with the instructions for breakaway rooms. So we are actually going to have 3 working groups, and this we've decided to do 3 working groups because we have 3 evidence-based case studies that we actually know of. So the first 2 are on enrollments and retention, and then the third one is on reintegration. So you will be put into different Zoom discussion groups like last week, where you also have 1 coordinator or even 2, depending on what breakout room you are in. So we'll be in the working group for 30 minutes. We've decided to also give you more time because the case studies are a bit lengthy. And then, as usual, from last week, you can pick one group representative who will be able to report back to the open forum with answers and also take questions from other participants. So when you come back, you will share your findings in about 2 to 3 minutes. And when after each group has presented, we will then also talk about your own country context, what's happening in your own countries, especially if your country does not fall under the 3 case studies that we'll be looking at today. Thank you. Thank you. Yes. So we have Ghana and we have Niger. Is it Niger or Niger? And Sierra Leone. So Ghana is enrollment and retention, and then Niger or Niger is enrollment and retention, and Sierra Leone is
Right, takufonerai tichakubatai zvakare tonotobatsirai vana.
Okay. Please, can we remember to mute our microphones? Next, please. Okay. So here are our groups, right? So breakaway room 1, case study 1, where I will be looking at the impact of free secondary education from experimental evidence from Ghana. And in case study 1, we'll have Ethiopia, Liberia, Malawi, Namibia, Eswatini, and Tanzania. And in breakaway room 2, case study 2, we'll be looking at girls not brides secondary education as a shield against marriage case study. And we'll have participants from Eritrea, Ghana, Sierra Leone, Mozambique, Uganda, Gambia, Kenya, and Lesotho. And then case study 3 and breakaway room 3 will look at the national policy on radical inclusion in schools and moving from, and also, so there are 2 documents. One states the policy, and then one looks at moving from just the policy to starting to practice. Yes. Thank you. So I just need to check whether who is helping us with putting up the different breakaway rooms, Marianne?
I'm here, Mercy. Enoch.
Oh,
So,
Enoch, thank you. Yes.
No problem. How long will the session be? 45 minutes?
It will be 30 minutes.
30.
Yes.
Okay.
Yes.
Shall we start now?
I think we can start. The instructions I read out, is there anyone who has questions who didn't understand? In fact, if you do have questions, please, can you direct them maybe to the coordinators that you'll be having in the different rooms?
But Mercy, could I please come in? What are the questions that participants will work on? Could you share the questions?
Yes, we can proceed with them. Yes, here they are. Okay, yes, here. So the guideline which we shared is the same guideline that we are also using as a prompt to say, you first of all identify the country. If it's possible, please identify the country and the sector or system level where the intervention is taking place, e.g. Nigeria, Ministry of Education. Some projects have names. If there is a name, please include it. And also, before you go forward, I think it's important to check what barriers were identified prior to the intervention, and maybe even how these barriers were actually identified. And then after that, you look at objectives of the intervention. Why? What were the specific aims? What is it that the intervention is set to achieve? For example, if we are saying that we have a certain percentage, of enrollment, maybe that is what we need to, the intervention will be trying to address. And then where we talk about the summary of intervention, is just looking at who is involved, at what level are they involved. So it also makes up part of the information that you already have up there. And also, maybe importantly, if you are able to see on your case study how the intervention was received by the different countries involved at different levels, in the communities, in the government, in the schools themselves. And then program implementation, where did it take place? Was it a rural place? Was it urban location? And also, this also speaks to the system level. Are you able to identify where the program was implemented, and also to report on the results? So these are quite a number of questions and prompts, and I know that we will not be able to finish all of them in this session, which is why we circulated these guidelines so that you can still go and work on it even after you leave. Thank you. Yes. So one of the most important questions that one of our participants also asked on the survey prior to joining the training is wanting to understand success indicators, right? So when you look at the case study that you'll be studying, you think about in what ways does the intervention close the specific gender gap identified? So in some cases, we can say a success indicator is the fact that a particular gender gap has been closed. So when you have evidence-based programs, they will be able to say the gap was closed by such a percentage. And then you will see, even when you are on your own, maybe going through some other literature, that there are also projects that don't actually say what is the percentage, what is the success, how did the success happen. And then if you are able to see, like some of the interventions I was looking at even over the weekend, most of the time they indicate what other interventions were done in that particular country. Like, for example, we already know that at the moment, most countries have met the parity at primary level, and we are now focusing on secondary level. So if the case study gives you examples of countries that have achieved or implemented a certain project, you should always make sure you put it maybe under previous indicators. And also just to note what challenges were experienced and lessons learned. Because if you were to transfer a certain intervention to your own country or to recommend it, you need to be able to convince the people you want to partner with to say, okay, we know there are these challenges, but here is where this intervention was actually implemented, and this is how they dealt with the challenges. Yeah. So that brings us to the end of our questions as we go into the different breakout rooms. Just to check, Marianne, do we have an invited speaker on hold waiting to present, or can participants just go ahead?
Mercy, so we did have someone. Esther had joined, but I think she's dropped off now. I don't see her name. And the Rosette from Uganda, I don't see her name either, unless she's coming under a different name for this session. So can I just ask Rosette from Uganda and Esther from South Sudan, are you with us here in this room?
Rosette from Uganda and Esther from
South Sudan, do we have you?
Okay.
So I don't think they're here right now. They were, one of them was here, but she might have dropped off. I'm trying to connect with her. I think proceed with your activity. And
I've just joined. I'm from South Sudan. I've just joined. This is Babu Emmanuel.
Yes, hello, Babu. Babu,
Yeah.
we would like to have Esther join. Is she with you?
Yeah, unfortunately, we're not in the same direction. She's also in the field in Capoeira, but I've just arrived from an area where there's no network, and she called me, and I've just joined. My apologies for joining late.
Okay. Okay,
Yeah.
so Esther was here before, but she's dropped off. She has to present. I think proceed with your activity, Mercy, and then we'll just try to give her time as soon as she rejoins when they're done presenting. Go ahead.
I think she's just trying to get connected, and then maybe she'll join later. Well, thank you.
Okay, thank you, Babu. That's helpful. Thank you.
Okay, thank you so much. Thank you, Babu. Thank you, Marianne. So it's also good that we go straight away into our breakaway rooms and start working for the next 30 minutes. And then when we come out, if we have people that are here just to present, we can then do that. But for now, let's go into our different breakaway rooms. Thank you.
Success in Sarafino. Can you tell me which country you're from? And Betty?
Uganda. Hello.
Okay.
I am in Burkina Faso, but I work for the African Union CFA, so I wouldn't say I'm coming from a specific for a specific country.
Is there any group you want to join?
Yes, room 3, please.
Okay. Sarafino and Matafeng. Can you hear me?
Yes, Sarafino is around.
Okay, may I ask what country you're from?
Sarafino is from South Sudan.
Okay, okay.
South Sudan with the Babu Emmanuel.
Okay.
Yeah.
Hello?
Yes,
Hello,
hello.
Mabor. Yes.
I just disconnect. I didn't know. We have come back to the main room.
Yes.
Hello, Mercy.
Yes,
Oh,
yes.
hello. Yeah.
Yes, we
Okay.
can.
Maybe we
Welcome
have
back.
been retrieved. We have been retrieved from our room without knowing. So we just come here. Thank you so much.
Oh. Yes, you can
I
usually
couldn't,
see the time
I
left on
couldn't see the mic.
Okay.
I couldn't see the mic, which made me keep quiet throughout the discussion. I'm so sorry.
Okay, all right. But you did read and you listened. Okay, it looks like we are all back. So may I request at least one group to do their presentation first? Do you want me to pick the group or are you going to volunteer?
And we have the group too because electricity went off from my end, and I may be off. So if we can have group 2 present.
Okay, thank you. Group 2, would you like to go ahead?
Matsalisu, this is our group. Would you like to present? I can share my screen to show the points, or maybe Zamzam can. Is that okay with you?
Well, Marian, I can assist. No problem. I was expecting that everybody else can, actually.
Okay, well, I think that Matsalisu is here in the room. Matsalisu, are you presenting or should Makube go? She had agreed before.
We can help. Makube, may
Okay.
you please carry on? Yes, please.
Okay, thank you very much. Good afternoon once again, colleagues. We are group 2. Our case study is actually based in Niger. And the name of the project, the intervention was School Girls, Not Brides, just as displayed there. Secondary school education as a shield against child marriages. Now, we went through, though in a rather quick manner, we went through the case study. And what we found out is that there were barriers that were identified before the intervention, which include those that are listed. More specifically, we learned that there were early marriages, which were causing low educational attainment, especially for the girl child. And that eventually results into some poor human capital development successes, not successes as such, but the barriers also included issues of girls taking care of household work, lack of role models for women to proceed with education. There were also logistical issues, cost, and many others. Now, the objectives of this intervention are stated below. Yeah, the main objective, which we wrote in white there, was actually to find out if removing all these barriers could discourage girls' early marriages. The study found out that the intervention was effective. This is the result in reducing child marriages rates among girls who received scholarships. Girls who received scholarships were half as likely to be married by the age of 18 as girls who did not receive scholarship. The study also found out that the intervention had a number of other positive benefits, including increased enrollment rates in secondary school, improved academic performance, delayed childbearing, etc., including increased life satisfaction. Now, there were also issues of financial barriers. Indirect cost to education hampers the success. This includes the loss of income from girls who would otherwise be working at home or in the fields, in addition to the challenges that we should at the beginning. We did not finish, it's work in progress, but this is as much as we can give you for now. I don't know if colleagues would want to straighten up or add to what I've just said.
Adding up to the objectives, we also had the point of the introduction of law enforcement that could help to prohibit the early marriage and eliminate this one you mentioned. Yes, you only left that one. Thank you.
Okay, thank you so much, Group 2. Thank you so much for all those answers, observations. We can move to Group 1 or 3, open forum participants later. But for now, Group 2, Group 1, who would like to present?
Group 1 can present.
Thank you, Martha.
Group 1 was looking at the case study from Ghana. And the name of the project was The Impact of Free Secondary Education, Experimental Evidence from Ghana. It actually targeted 2,000 youths, and the study was done for a period of 12 years. In terms of barriers, the study was trying to address issues to do with actually the barriers were hard to reach areas. Students were traveling long distances to get to school. And because of that, they were also subjected to harassment along the way, which was a security issue. But it also had issues to do with the limited access to secondary education, in addition to the two barriers that I've talked about. And this limited access was as a result of the entrance exam. The pass rate was kind of low. Only around 40% were able to pass to proceed to the next level of education. But also an issue to do with the examination fee. So those two were also making access to secondary education difficult. In terms of success indicators, we had a number of them. One was that the learning was taking place whilst using the vernacular languages, which was actually making the learning itself to take place easily. Secondly, they increased the number of qualified teachers, which also improved delivery of materials to the learners. The other one was, as a result of these initiatives, it was observed that completion rate increased in due course, and with those who got the scholarship, it also made them increase their education attainment by about 27% points. The other one was those that were retained in school had 7% likelihood of not getting pregnant along the way or after this particular period of study. So this had actually helped in making sure that the fertility is not affected or is kind of controlled because of remaining in school. The other success indicator was that gender parity was kind of achieved by about 45%, much as the project had targeted to get to 50. My friends can add more in case I couldn't capture other points. Thank you. And off.
Thank you so much, Martha, for such a comprehensive answer, very comprehensive. Does anyone from the group want to add something before we go to group 3?
I think well done.
Thank you, Martha.
Welcome.
Yes. Are you adding something? Oh, okay. Okay, we can go ahead and have group 3 present their findings.
Thanks, Marcy. So our group had some technical issues. So I will just present on their behalf, unless we had asked Babu to be the group representative. Maybe if he can also, if his connection is good, maybe he can also share some information on the case study. So maybe I'll give him a moment to see if he's able to share. Otherwise, maybe I can present on his behalf.
Yes, please go ahead.
Sure. So if Babu isn't able to present, so some of the barriers for the intervention were language and social norms, and that was shared by Angela in terms of implementation. And so what we looked at was a case study in Sierra Leone and the relevant, yes.
Hello, Gabriel, are you talking to me?
Yes. We were wondering if you'd be comfortable to present information on the case study.
Okay. At least you can zoom it a bit.
Sure.
Yeah, it's okay. Of course, this is group 3, and we have this finding and barriers. Can you bring it back? Barriers before. Yeah, you are there. Yeah, thank you so much. Barriers before intervention, language, social norms. That was actually our case study. Objectives of intervention. The policy particularly emphasized the inclusion of historical marginalized groups, pregnant girls and parent learners, children with disability, children from rural and undeserved areas, and children from low income families. Transform policy into understandable language, change social norms to get pregnant girls going back to schools. Our ministry converted policy to local language so that communities can understand to transform social norms. The interventions inclusion, as we mentioned for the case of South Sudan, is that we don't have policy. South Sudan don't have policy, but they have national strategies for girls. They also have the ministerial order that actually talk about inclusions and education for all. So inclusion in terms of learning from the policy education point, action, the action we have, sorry, it is in the language of the present. The action that we have in the ministry is to support inclusions, provided a strategy, and also allocate 5% to schools as to cater for the people living with disability. This is a strategy and indicator to ensure that we support people living with disability for them to be retained in the schools and be able to complete the levels. And we have the monitoring strategy to ensure that policy is being maintained. So ensure pregnant girls are accepted in schools and part of education accepted. This strategy actually is look like the strategy is look after girls to allow pregnant girls to come back to schools and be retained, also get promoted. The other success indicator is South Sudan of the monitoring teams in the state. We have what we call the education transfer monitoring teams, and also monitor the projects. And that monitoring teams monitor some indicators that are indicating the success of the project in the state and in school as well. Targeting both urbans, this is actually Servino have contributed this. Government providing boarding schools to girls. Of course, boarding schools are being provided to girls in urbans and rural areas. My colleague Babu also was contributing the area of targeting girls to be in school, monitoring payment, enrollment now has increased and the behavior change. There are some of indicators that yes, when we are paying a cash transfer, the rate of dropouts and the behaviors of girl child in school have changed, and we are seeing some indicators that yes, there is a retention and there is promotion of girl to the next levels. I think thank you very much. This is our group 3 presentation. Thank you.
Oh, thank you very, very much. Thank you very much. And welcome back again, everyone from the groups. So now we are going to open the floor to any questions participants might have. Before we move on, Marianne, did you manage to find out whether there are presentations from countries or we can proceed? Okay.
Yes, so I've been communicating with them from South Sudan.
Yes.
Esther is in the field right now, but she has a replacement, Mei-Ling, Christine, Lenny, but I'm trying to help her get online. So I don't see her online yet. I've sent her the Zoom link about 5 minutes ago. If they join, fine, but if not, let's continue with the other participants. Maybe they have examples to share.
Sure. Thank you so much.
Okay, can I just, sorry, can I just add on? This is Babu.
Yes.
Yeah, just I wanted to add some few activities which is being done to make sure that we have our girls in school. Mabor has just mentioned some others, like the cash transfers, where he was mentioning that we have monitors already in the ground, trying to see into it that this little money is given to the girls to make sure that they can support themselves with some other challenges which may arise due to poverty in most of the families. Another activity which is also being done to make sure that the girls are in school is the community mobilization on the importance of girls. We have activities like Back to Learning, which always is carried in all the states to make the communities aware of what are the importance and how we can support. Because without the intervention of parents sending children to school, you find that at times we can have many of them back just at home. So this activity is also assisting a lot the mobilization of the children so that they come to school and then they continue their education. Another activity which is being done, which is catering for not only girls, but both boys and girls, is a provision of what we talk of here as a capitation grant to the schools. So there's money which is sent to the schools to support learners. This money is not meant for the teachers, but it is meant to support the school in other activities, like in case they limited access to things like maybe the toilets. They can even construct a toilet. They can even have other facilities like classrooms built where it benefits both the boys and the girls. Then also there's this continuous professional development, which is ongoing. The list is long, like even the training of the SMCs, which is all being done to make sure that at least we encourage our teachers, we encourage our parents to make sure that the girls are maintained in school and they may continue. This is just some few that and maybe if there's time, then I'll add on more if time could allow us.
You can use the guidelines I shared to put all the interventions you are telling us about, and then you can put in the folder or email us. Yes, Marianne?
Yes, Mercy. So I see now that we have our two presenters, Mei-Ling and Rosette. Mei-Ling from South Sudan and Rosette from Uganda. They've both joined. I don't know if we have a lot of time, but we do have slides from Mei Ling. Maybe she could present.
Yes, that's fine. Thank you, Marianne. So what we can do, we had opened the floor for people to now start to ask each other questions and to share. So we can go to we can give this time to our presenters. And then if we still have a few minutes, if there are more questions that participants, or even feedback that participants have, then we can give them a few minutes to ask.
Yeah,
Excellent.
Thank you, Marianne. And thank you, Mercy. I think I just joined in. I found Emmanuel was already presenting, and probably on behalf of the Ministry of Education, because the slides that I shared were forwarded to me by Esther, the Director General. She wanted me to support. But now that Emmanuel has done the presentation, maybe we'll give chance for questions later on, then we'll come up with any additional comments that we have. Because I've not heard what, I just joined in the last minute when Emmanuel was summarizing. I believe he captured some of those points, not sure. Thank you.
Excuse me.
Okay, thank you.
Excuse
yeah.
me, this is Sarafino.
Okay.
Emmanuel Babu, the presentation of Emmanuel is not the presentation of South Sudan. It is of the group. I'm trying to inform Melling.
Yes, that's
it
what
is
I
of
was
our group. Yeah,
yes.
it is the one of a group.
Okay. So
you
are
can
you
go
still
ahead.
okay? So can you
can
present your okay. So do I need
Christian,
to show
can you go ahead? Yeah, you just
okay.
shared. In fact, it is good if you can share with us, because I was even just talking off head.
Gabriel has the slides. Mailing, Gabriel will show his screen now, and you can go
Adding
ahead.
some presented by my phone.
We only have about 7-8 minutes, so if you can keep it brief, please, Mailing.
Yeah, it's
Thank you.
even brief. It's brief. Let's go to the next slide. It's so brief.
Thank you. Thank you.
Yeah.
Thank you. You can go ahead.
Yeah. On this slide here, the Ministry of Education are just trying to give some historical background on gender parity in education, in that there is, there is an increase or a slight increase between 2013 to 2021. And she also highlighted that this growth is due to various programs that encourage girls' education, in that parents are motivated to send their daughters to school to benefit from the cash transfers which are provided to the adolescent girls. I think Emmanuel has briefly highlighted about this. And then the provision of cash transfers also encourage attendance of girls, and particularly the adolescent girls. We can go to the next slide here. So she said, like she said, there are a number of programs that, the ministry and partners are working on that have improved the enrollment of girls. And one of these is the cash transfers, which has motivated girls to enroll and remain in school. And then girls are also validated to ensure that they are the right girls. She's trying to give the processes which take place before a girl qualifies for the cash transfers. And one of the processes is the validation of these girls in schools in the presence of the teachers and the officers that are sent from the national and state level. The payment is to encourage enrollment, attendance, and retention of girls through the education system. So offsetting some of the direct and indirect cost barriers to education. So the indirect, like what Emmanuel was saying, some basic need for these girls that they need outside the school environment, but they also contribute to their attendance and retention in school. Then reducing the financial burden on family, yes, and cash transfer continues to target girls from primary 5 to senior 4, and regularly, which has supported these girls to attend classes regularly. So it was just, she was trying to describe what this cash transfers for girls is all about. Next slide, please. So another, some of the programs or the enrollment drive, one is the social behavior change and intervention, still under the Girls Education South Sudan program, where, a lot of social mobilization is being done through the radio, and topics range from early marriages, importance of education, role of community, PTAs, teachers, all these are discussed through a radio program. And also at the community level or at the school level, they organize what we call the listening groups, where the PTAs or the parents of these learners are gathered in one place and then to listen to a particular theme during that period. Could be early marriage, could be dropout, and then they discuss on that topic and come up with some of the community-based solutions to what the challenges are that prevent girls from going to school. So girls are also empowered against some harmful practices like the child marriage, and I think the Minister of Education is leading this seriously through the Minister of Education, who has taken upon herself to ensure that girls or young girls who are forced into marriage have a reporting mechanism and they get the support that they can be given at that level. And also sensitizing girls to know that cultural practices are not only the bad practices, but also they are good practices that can be promoted and also good for their well-being as part of the community. Next. Advocacy and community awareness. These are the direct community mobilization activities like the Back to Learning campaign with key messages targeting parents or communities around girls' education. And then also, yes, they use the Back to Learning campaign days, which are mainly, driven by the Ministry of Education with support from UNICEF, the National Girls Education Day. And then they have the PT and SMC training and also awareness. So all these are just kind of social mobilization or advocacy to ensure that girls are sent, all children are enrolled, but with a particular messaging for girls which target parents and communities at large. Then also the Ministry of Education through the minister also have come up with another key interventions of conducting conferences, and some states, these are conferences discussing challenges around girls' education, and early marriage actually is one of the themes in these conferences. So far, 2 have been conducted and more conferences are being planned. And the discussions here or the meetings target community leaders, including chiefs and all community leaders at all levels, and then the state authorities at the ministry and all other line ministries and the partners who are supporting the ministries at that level. So the dialogues have been conducted, and at the end of every dialogue, a communique is signed with the key resolutions, giving roles to different stakeholders. So the next plan, according to my discussion with the Esther, is that now the ministry will come up with a plan to follow up on some of those action points and see how far the particular states or the issues are. Maybe somewhere the beginning or mid next year, they need to do the follow-ups and provide feedback. Then the ministerial order, is there a writing in the next slide? Yeah, I think the ministerial order was something against girls' early marriages, should be around that area. The colleagues who are in the forum can also add in. I hope I've been very clear. This is Esther's presentation, but I've tried to be as brief as possible. The information also have gone out to you clearly. Thank you.
Oh, thank you very, very much. Yes, I see Marian's hand.
Just,
I
wanted just to add on the ministerial order. The ministerial order which was issued was on the side of the re-entry for the girls, for pregnant girls to re-enter the school. That's just a contribution that I wanted to add on it. Thank you.
Okay,
Thank you, Emmanuel.
Thank you, Emmanuel. You can go ahead, Marianne.
Thank you, Mercy. I had a question actually, Mei Ling. On the first slide that you shared, there was an interesting chart that showed the academic years of 2013 and then 18 and then 2021, total enrollment, male enrollment, female enrollment, and the percentage of like girls. Could we maybe look at that slide one more time? Are you saying that the cash grants, the program that South Sudan has undertaken, has contributed to a change over time? Could we look at the evidence just again briefly, Gabriel? This is slide number 38.
Yeah,
I thought that was interesting.
Exactly, that's my understanding. And Emmanuel and his team can add, because she did not put any title to this, but I believe these are the increments based on the cash transfers and the capitation grant which are provided to the schools. Emmanuel, are you there? The slide is not titled.
Yeah, I'm here. I can chip in also. In fact, this data is got from the EMIS, the annual statistics, showing the increase in the enrollment of girls. Yeah. And as I said earlier on, in fact, I could not give you the figures because in most cases there is need for evidence to show the increase in the enrollment of girls. But good enough, Christian has given us this slide where it is showing some increment in the enrollment of girls.
Okay, thank you so much. It's also interesting to see that there is an increment after COVID actually happened. There's still an increment. Yes, you can come in. Before you come in, I to make a comment to say, because participants were struggling to get online today, I think we started around 10 to 15 minutes late. I note that we should have closed by now our training sessions. So if you can just bear with us maybe for just a few more minutes while we take more comments, questions, and wrap up. But thank you so much for the presentation, Manny.
Thank you. Yeah.
Yes, you can come in. The gentleman who wanted to say, yes.
This is Sarafino from South Sudan.
Yes, yes, sir.
When you look at the increment, it is due to several interventions. You remember we mentioned several interventions. So those interventions have helped this increment up to this 47% in 2021. Several interventions which we have mentioned. Thank you.
Okay.
Yeah.
Thank you very much. I think, yes, I can also add to that to say that in the case studies we were all going through, you would have seen that sometimes they would have more than one intervention, because if they gave a scholarship for school fees and the girls still didn't have uniform, still didn't have food, still didn't have transport, then they would actually end up not going anyway. So you would find that there's different interventions that are focusing on the girls at the same time. So what's important, especially for the upcoming sessions, is to identify also at country level which stakeholders are working together, because it's a very huge problem that we have, and the partnerships are the ones that actually help so that they deal with different aspects of increasing enrollment and retention. Okay, thank you. Is there anyone else who would like to comment, observe, present something from their own country? Yes, you can go ahead.
Thanks. I don't know how to put my hand up, but I would like to.
Please go ahead and speak.
Okay. All right. So, you know, I was looking at the South African situation, and I was looking at behavior change, and specifically at comprehensive sexuality education in life skills curriculum. I was looking at that program, and I was seeing that all the indicators were actually worse because of COVID. That teenage pregnancies actually had a massive increase, that gender violence also had massive increases, you know, contrary to the objectives of the program. And I'm wondering, is this just specific to South Africa, or did all the other gender programs have similar negative results during this period? Because it seems like it's just had an enormous impact in this country.
Yes, thank you. Thank you so much, Angela. Yes, we know, like in Southern Africa here, I mean, over COVID, I was also working with civil organizations in Zimbabwe and in South Africa, and there were a lot of dropouts, like millions, as well as pregnancies, underage. So I was also wondering, from the last presenter, I actually wanted to ask whether the figures that they presented were national figures, or was it just a specific area? But also, I think what's important to know is that if we are saying, okay, we have a 42% increase as opposed to maybe 10 years ago when we had 40%, what does that actually mean? It still means that a lot of learners are out school. You can go ahead. If there's anyone who would like to answer or to present their own case study. Angela,
Hello?
while we are
Hello?
for someone to speak, yes,
Hello?
I'll give you just now. I'll give you the floor just now. I wanted to ask Angela if she would be happy to also share the South African examples that you mentioned. We'll be happy to have them, especially if you can use the guideline form that we prepared, and then you can either email Marianne or I think that would be the best thing to do.
Sure. No, I have done it. I've done the assignment and I can send it. I don't know if we've got time to do it now.
Or because you wanted to present.
No, I've done the assignment in terms of that template. But
yes.
my to my surprise, I was looking at comprehensive sexuality education in primary level in life skills curriculum, which is a SADC program, which many of the Southern African countries have been implementing for a number of years. But when I started looking for the success factors and the previous indicators, I was shocked to see that there's been a massive increase in teenager births. There's been a worsening in terms of HIV/AIDS prevalence, which were the two key areas, plus of course tuberculosis, the two key areas which this intervention into life skills was targeting. So it was not a successful program, but it's a program that's going on for many years. And I know that UNESCO is still promoting it across the whole of Southern Africa and East Africa. So I was just curious, is it just South Africa that's experienced this awful decline, or it's behavior change? So it's not enrollment and access, it's looking at changes in social behavior.
Okay, thank you, Angela. Thank you. There was someone with their hand up who wanted to come in and say something. Hello, Lesotho. Did you have your hand up?
Yes, please. I was saying, I've noticed that.
Yes, you can. You are muted. You can unmute yourself and speak.
I was saying, going through the sessions we had and all the case studies we had, I see that my country, Lesotho, is exceptional, as the enrollment rate of boys is a little bit lesser than the one of girls. Here we have high enrollment of girls than boys, meaning that we don't have a challenge of girls. Yes, thank you.
Okay, do you know if Lesotho has undertaken any programs, especially after COVID, either with national, provincial, or even global partners?
Not as far as I'm aware, but what I've noticed in most cases, all the studies that are being made are made towards a girl child. Mostly, in most cases, the focus is on girl children, but in Lesotho, it's a different case because boys are now lagging behind than girls. We have a high enrollment in both formal education and non-formal education.
Okay.
Yes.
I hear you. Yes, I think at some point maybe it's something we are going to have to discuss. Some of our coordinators from UNESCO may be able to also answer that question, because it keeps coming up on the fact that in some contexts the boys are now worse off. Yeah, who else
Hello, can I
wants
say
to?
something?
So I just wanted to encourage you that even after this session is done, if you had not finished your guideline document, you can go and finish it off and then email it to us. And then we can take everything that you are going to email to us. And we are going to use it in the final report, but it's also important now we can come up with a table that shows what's happening in all the different countries. So I would be very grateful if you could do that at your earliest convenience. Yes, please come in. Someone wanted to talk?
Yes, Petros from Ethiopia.
Yes.
Can I proceed?
Yes, sir, you can.
Thank you. I'm just motivated to speak because of the last speaker. Girls might come to school, and in our cases, we don't have much problem in relation to gender parity. The question is, are they attending classes? Is there an issue of retention, completion, and performance of the girls there? If they are successful in relation to performances and completion rate, these all things we say there is gender parity, gender equality, and equity. But the coming to school is not the end result. So we better check all indicators of equality and equity in this regard. Thanks so much.
Okay, thank you very much. Thank you very much. Yes, we've got, I hope I'm getting the name correct. We've got Nian, UNESCO China, who wants to come in. Thank you so much. Please, you go ahead. Did I say your name correctly?
Yes, that's correct. Thank you. So I'm just very happy that that one participant mentioned they're having more boys, less boys enrolled compared to the ratio of girls. So please see the link we've sent in the chat box on the UNESCO publication on boys' disengagement in education. So I allow myself to just address some of the reasons behind this kind of phenomenon. This could be, for example, in certain societies, boys are expected to carry on economic duties like going out for work. And also, in some cases, boys are more easy targets of corporal punishment in schools from teachers. And also, boys with unconventional sexual orientations might be more easy targets of gender-related school violence. So a lot of reasons can explain for this. So please refer to our global report, and we look forward to your feedbacks. Thank you.
Okay, thank you so much. Thank you so much. Marianne, would you like to come in on the issue of girls versus boys, or is your hand up?
No, I was giving a thumbs up. I was giving a thumbs up to the excellent contributions from the UNESCO colleagues in the chat box. We will put them into the resource pack, and we'll make sure that people are aware of them. So thank you for that. Mercy, before you continue, I don't think we have Rosette with us anymore. She joined briefly. She was supposed to present from Uganda on some practices that are helping girls enroll and stay in school and complete schooling, but she's no longer with us. So you can proceed.
Okay, thank you so much, Marianne. Even if she can just email you what her contribution was going to be, that would also be great. Yeah, thank you so much. So for now, I think I'm going to open the floor before we close, for anyone who still has a burning question or an observation, and also what you think you took away from the different case studies, especially. Was there anything new? Are these case studies, is it things that you already know that's happening? Would you go and suggest to have it in your own country? Okay, so while I'm waiting for people to put their hands up, maybe I'll just mention the DREAMS project that is done by PEPFAR. which is the United States platform that was created many years ago by the government to help, especially with the reduction of HIV/AIDS in Sub-Saharan Africa. So I know that currently DREAMS is being implemented since 2015 in 16 Sub-Saharan countries. And what they do is they teach girls. Yeah, it's only, so the project is also just based on girls. And the idea is also for retention and also enrollment. So what they also do is they focus on migrant children. Like here in South Africa, they go to inner city Joburg, you know, places like Hillbrow, where migrant girls live who may not have maybe an identity document required or a birth certificate required. Some of them are refugees. So some of the, through the Department of Social Development, they help the girls to get documentation so that they can actually enroll in school. But one thing that I do know that has been a challenge is that when they then get to exam time, if they still don't have an ID, they are not allowed to write exams. But the program is targeting especially HIV/AIDS, so girls get taught, because here also in South Africa, research shows that the sex education is not, it's contested actually. So, and it's normally done during what we call here life orientation, you know, in part of the school curriculum, that's not that important. So what, between the government, the US government and the South African government and 16 other African governments, they are all working together through various platforms like the Department of Health, the Department of Education, the Department of Social Development, so that the Department of Social Education will give food to poor children. And then the health department will also make sure that they provide testing and other things. And then the NGOs that are there also make sure that they track girls and they report intervention that I know about here in Southern Africa, that's in 16 countries and helping with enrollment and retention. Thank you. So moving forward, we are getting ready to round up our training session. Is there anyone else who is still interested in contributing something they couldn't contribute?
I wanted to say something. Sorry, I have not put up my hand. Betty here.
Yes, thank you. Which country?
Yeah. Uganda. I'm just making a comment, a general comment, not specific from
Yes,
to Uganda.
Yes.
Yeah, just from listening in to the presentation, it's very, very clear that one must know the context and the situation and the challenges or the barriers that are being addressed in order to appropriately tailor the interventions. But I'm also seeing that interventions have to be holistic and multi-pronged. Can you hear me?
Yes, yes, we can.
Yes, so I'm also seeing, you know, from the cases that it has to be multi-pronged, tackling all the barriers that will stop girls from going to school. For me, that is really a key takeaway that I can say I'm going up with. One kind of intervention may not address the situation. Yeah, thank you.
Okay. So you are taking away that there are partnerships required in order to get the girls into school or for them to stay there. One intervention will not necessarily do it. Thank you, Betty. Anyone else who has either a question or what you learned today, what you think was very important, or even what you still would like us to focus on going forward?
Yeah, not a question. Thank you. Also haven't put up my hand. but also would be interested to learn from countries like Lesotho. Is it Lesotho? The lady who said they have more enrollment for boys and girls, because in the South Sudan context, a similar situation seemed to be coming up in one of the states, not across the country, but in a particular location. I think it will be very interesting to learn from countries that have the same experience and what have they done and whether it has worked or not. So that for countries that maybe are heading towards that direction, they could be able to mitigate some of these challenges, if any. Thank you.
All right. Thank you so much, Maylin. Yes, that's why I designed the guideline documentation, so that even if people are not able to present online while we're on air, because our time is limited, if everyone fills in the forms and you email them, we can take those examples and put them into graphs, and then maybe show them during sessions as PowerPoint presentations for more discussion. But thank you very much. Yes. Hi, Marianne. If I was going to say, if no one else has anything to add, we can wrap up and just speak about the upcoming session.
Yes, Mercy. Allow me to take 1 second to share the resource pack folder with participants to show them where we're keeping everything, since a lot of resources were just shared and there were requests for resources.
Yes.
Okay, so everyone, I've shared my screen. This link that I've shared with you is an open access link, so anyone can view and comment on the files. But if you want to upload something to this folder, it'd be better if you send it to us first so we can review it and we can put it in the right folder, since there are subfolders here. Let me make the size bigger. Okay, so this is the resource pack folder. It's a developing folder, and we're constantly updating it with new resources. You can see the 3 sessions master slides are here from last week and then today. The recordings of sessions are here in this link. We're not uploading the whole video file, we're uploading the YouTube link to each session. And there's also the parking lot here for questions and comments. Please add questions here. These are like the big questions that you might we might not get to in the sessions, but that you want us to think about and respond to. We're responding to those. Here's there is a UNESCO glossary here of terms that was shared by our UNESCO colleagues in this community of practice on understanding gender equality and inclusion in education. The resources from today that they shared will also be uploaded to this folder. And right here, these are the case studies from today's session and from last Thursday and from today's session. We realized that they were long and that not all of you were able to really get through them. That's fine. This is not an end-all space in each session. We're going to be returning to ideas in the future. So don't worry if you didn't get a chance to read the case study that you wanted to. And over here is the examples of country programs. So far, we've had an example from South Sudan, and we hear that Angela has a case study to share as well. So, or sorry, I should say a country example. So if you have an example to share of a program in your country, we would love to learn about it. It would be just amazing to have that in this space where we have lots of programs that are being compared. Like we just heard we just heard from South Sudan that they want to learn more about why Eswatini is experiencing more boys enrollment than girls, and that might be happening in one of their states in South Sudan. Maybe there's a particular intervention that's leading to that phenomena, or maybe there's something at a larger scale happening in Eswatini that's leading to that phenomena. And also, I know that that's the case with in some cases with teachers. There are more female or more male teachers depending on where you go. So please let us know through this worksheet what kind of interventions are making a change at the country level in your own countries. And we're going to be featuring them throughout this community of practice space. So Mercy, back over to you. I just wanted to share those resources. Back to you.
Thank you, Marianne. This is very helpful. So maybe other people are asking themselves how they can get into that particular folder. Do you send an email? Is it an email with a link? Are you going to be sending again, or have you sent it already?
So the link has been shared. It's going to be shared again in the chat box right now. I'll send it. And the link is it's the same link. It's the resource pack folder link that we've shared at every session. I'll share it again and via email and also on the WhatsApp group.
Okay, thank you. Thank you, Marianne. Yes. Any comments, questions from anyone?
Miriam, yes, this is Babu again.
Yes.
Unfortunately, I can't raise my hand because I'm using a phone. And
okay, no
what you have just said, in fact, we have ideas that we wanted to include in the document. I don't know how I'll make it because I came to the field just without a computer, but I'll try to see whether I can get a computer with a friend, then enter those information. As you can see from the presentations, I didn't do any contribution because I'm still here very much engaged with some field work. Like yesterday, the other time I didn't even join because I was in a place without network, but I'll try to see that I at least include some other interventions that we have in South Sudan in the document, so that we can also have our presentations presented. Otherwise, I will love to always be there. I don't know, do you have a session tomorrow? Because again, tomorrow I'll be going to another area, mountainous area where network could be a problem, just to find out. Thank you.
Okay, it's every Tuesday and Thursday, the same time. So we are now left with this coming Thursday and Tuesday and Thursday next week as well, same time.
Okay, I'll try my level best to make sure that tomorrow I come back so that Thursday gets me where there's network and I join early.
Okay, so we are logging off now unless there's anyone who has a question that still hasn't been answered. Maybe they will put in the survey, or they would like to say it on the platform. We just have a few seconds to do that, and then we can all log off. While we are waiting to see if there's anyone who has a burning question, session 4, we are going to be talking about the cost versus benefit of not educating girls beyond the individual human rights violations to the socio-economic, political, cultural effects. Okay. So we want to review the cost versus benefits. So there are more case studies that actually show. And in the first session, we also talked about, even last session and this session, we kept making reference to, someone even talked about the intergenerational effect of not having access to education or certain levels of education. So session 4, that's what we are going to do. And we are going to also email you the activities a day before you come online to participate. Yes. So on my side, I'm done. Participants, if you don't have any questions that you would like to ask, I think I'll hand over to Mary-Ann to close the session in case she has something else she wants to add.
No, I think that's it, Mercy. So thank you. I'll just turn on my camera for a moment. Thank you so much, everyone, for joining. What a great discussion we had today. As you can see, these discussions are oftentimes very fluid, very human, and we're contributing, we're engaging, and these are not very highly structured or very formal discussions. We're here to learn, grow, share. We all have something important to share, and I think that you're showing that a great example of that. So please feel welcome. Please feel comfortable unmuting and sharing an idea in this space. And please bring evidence from your context, like we saw today, from South Sudan and other countries. It really helps to, when we back up our statements by showing that it's making a difference somehow. So that's all I wanted to say, and we'll see you on Thursday this week. We will be discussing gender responsive education sector planning. It's a very long term, gender responsive education sector planning, GRESP, it's how it's abbreviated. And we'll be hearing from some organizations who are implementing GRESP. So UNESCO IIEP, and we'll also hear from United Nations Girls Education Initiative, UNGE. They have many resources to share. So it should be a great session. And we'd love to hear if any of your ministries are implementing GRESP planning, so that gender responsive education sector planning in your countries. So you might want to check, you might want to consult maybe some colleagues, see if there's a gender responsive lens that is used when planning is being done. We're talking about education planning next time. Thank you so much, everyone. If you want to turn on your cameras and wave goodbye. Thank you for joining. See you next time. See you on Thursday this week. Hi, Zamzam. Thanks a lot. Thank you. Merci. Matsaliso, good to see you. Delphine, hi.